You're live.
Okay, welcome folks. This is House Corrections and Institutions. It is Friday, May 1st. We're on a roll. Session gets out in May. We're on the home stretch. We have with us, and I'm not even gonna try to name the person because I'm afraid I'll butcher it. But we have the Managing Director of Justice Initiative, which is Chicago Beyond. And this came as a recommendation from our member, Representative Troy Hedrick. Just in terms of working in the correctional system. And Chicago Beyond was working with our former commissioner, Commissioner Demmel, was my understanding, and really looking at correctional systems, changes that could occur within those systems. And Representative Hedrick recommended that we hear testimony on this. And I'd also like to see if the momentum is still there with the Department of Corrections to continue some of the work that may have occurred with former Commissioner Demmel. So Nika, I'm going to turn it over to you. And if you could identify yourself for the record, would be great. Thank you.
Good morning, and thank you for having me, and thank you, Chair Emmons. I am Dr. Nika Jones Tapia from Chicago Beyond.
I know you have a document here as well, and I'm just opening it up for you to share with us what you would like to share.
Great. One moment. Okay, can you all see my screen?
Yes.
Wonderful. So again, good morning, and thank you all for having me to speak with the House Committee on Corrections and Institutions. We have been fortunate to work with the Department of Corrections there in Vermont since March of 2024, and have seen great work and great strides on the department's efforts, and will excitingly share those with you all today. Before I do, I'd like to tell you a little bit about Chicago Beyond, because I understand many of you probably are not familiar with our organization. We are a national philanthropic organization, and we work by addressing systemic inequities by backing the people who are closest to the issues. And in corrections, that is the people incarcerated in the system and the people working in the system. We do our work in three primary ways. We make strategic investments in community organizations and individuals. We lead national initiatives such as the implementation of our holistic safety framework, which I'll be sharing with you all this morning. And we put valuable insights into the space just to drive a change in thinking in how people show up and how we see and how we work. And that is what we did with our publication that introduced the holistic safety framework, which I'll also talk about in just a moment. Chicago Beyond has been around now for 10 years. We're celebrating our 10-year anniversary this year. And to give you an idea of our work beyond what I'm going to share through our initiatives this morning, we've invested about $100 million, dollars in over 200 individuals and organizations across the country in our 10 years thus far. And our work is currently spanning across more than 20 states. And Vermont, we are thankful, has been one of those states that we have been fortunate to work with. I am the Managing Director of Justice Initiatives, as you shared. I'm also a clinical psychologist, and I was the warden of the Cook County Jail here in Chicago for about 3 years. And prior to that, I was the chief psychologist in that system for about 3 years, and all in all worked in that system as a staff person, totaling 11 years. I have experience also working in a privately owned federal prison for a brief period of time. And people often ask me, about my experiences working in corrections, and specifically Cook County, which is, notoriously known. And I can say that, it was one that was filled with a lot of challenges. When I took on the role as the chief psychologist at the jail, we had just come under a Department of Justice consent decree. And in that consent decree, it named a number of systemic challenges that we were facing. Many of them included poor living conditions for people incarcerated, poor mental health care, mental and medical health care, excuse me, poor security practices. We had high uses of force, high incidents of violence across the spectrum, and the work was daunting. But when I took over the role as warden or executive director, I was leading the department. We successfully got out of the Department of Justice agreed order. And the only way we were able to get through that 60 plus page document of things that we needed to change across the department was with the help of our staff and with the help of the people incarcerated in the system. So I bring to this effort that we are currently embarking on with Vermont and a number of other systems a wealth of experience with high level systems change. I also bring to this the experience of losing a lot of staff while I was working in that system. I frankly retired in March of 2018 from corrections because I was tired of going to staff funerals. And it became overwhelming to also have to connect with the families of people incarcerated in the system who had also died while they were there in that system by suicide, by medical illness. It didn't, it never got easy. It got harder. And it wasn't just harder for me, it was harder for my team. And unfortunately, people outside of the system, because jails and prisons are so closed, they had no idea what we were dealing with. And so when I started working at Chicago Beyond, I had the pleasure of being able to engage with more than 100 staff and people who had been incarcerated in systems across the country and jail and prison administrators, all asking them about their experiences of the same system that I had just left. And we all said the same thing. We were not well. I included, and I'm a clinical psychologist, armed with knowledge on how to take care of myself. And I did not do a good job of taking care of myself. And what we learned from those conversations was that there is a duality of harm that exists in every jail and prison across the country. No one is exempt from it. Research shows us that correctional staff have one of the toughest jobs in the country. One state system, they surveyed their correctional staff, and 73% of them found that or said that they saw someone seriously hurt or killed on the job. And that is not normal. 100% of people incarcerated that were surveyed said that they had seen some violence inflicted on other people during their period of incarceration. And these are systems that are supposed to be there to help us to get to real public safety. And with these types of numbers of exposure to trauma, there was no way that we could really see our way through real public safety. Nationally, about 7% of the population experience post-traumatic stress disorder. But when you look at correctional staff in security roles, they have the prevalence of PTSD at about 5 times the national rate. Is unheard of. The prevalence of trauma and PTSD in correctional officers surpasses that of law enforcement on the street, and it surpasses that of combat military. About 60% of men incarcerated experience moderate to severe symptoms of post-traumatic stress disorder. And this is the severity. This is like at the more severe end of the spectrum. At the lesser end, I'll explain. So trauma, just so we're all starting on the same grounding of knowledge, it's an experience that we have that is so distressing that it overwhelms our ability to cope. And that experience, because we have difficulty coping during it, it impacts our social functioning, it impacts our emotional well-being, our mental, it impacts every aspect of our lives. And that experience of distress, you see that in the eyes of correctional staff when they first start working on the job. I had the pleasure this week of going out to visit another system we've been working with, and I met a young officer who's been on the job for 10 months. And he had almost like a deer caught in headlights type of look. And I knew that look because I saw it all too frequently in staff that were just embarking on their career coming into the correctional system. Like that is an indicator of distress that when you experience that every day for your 12-hour shift or 16 hours for some people, it overwhelms our ability to cope. I see it in the eyes of men and women who are incarcerated in systems. When you see them first coming in, it doesn't matter what they are charged with. Every person coming in has a look of fear when they go into a jail or a prison. And that is hard to shake, yet they are called upon to not show those feelings, staff and people incarcerated. And so, what we train people to do by their experience in the systems is to detach, to not experience emotion, to not experience connection, to dehumanize them. Like that is the dehumanization that happens in these systems at its core. Much worse also happens, but just at a foundational level. Um, and the numbers tell a horrible story in that correctional staff tend to live an average of 20 years less than people in the general population. The average age of a correctional officer at the time of their death is age 58 across this country. For every 1 year that a person is incarcerated, research shows that they lose an average of 2 years off of their lifespan. And so we know that what we are dealing with is systemic and it is something that warrants our immediate attention. And so we took all of those conversations that we were fortunate to have where people were really vulnerable with us. And we bubbled that up into a publication called Do I Have the Right to Feel Safe? And on the cover, I have to give a shout out to some partners in this space that we come to this work with because we do back solutions that come from people who are closest to the issues. We work hand in hand with correctional officers across the country. The gentleman on the left, I believe, of your screen, Andy Potter, he is a former corrections officer. He is a union leader, and he is the executive director of an organization called One Voice United. And One Voice United brings together correctional staff and union leaders from across the country, not to fight reforms, but to say we deserve reforms in these systems because we are negatively impacted and we deserve to be a part of the changes so that we are not put upon, but we are a part of it. The gentleman on the right is Ronald Simpson Bay. Ronald Simpson Bay was formerly in a leadership position at Just Leadership USA, which is a national organization that engages with people formerly incarcerated and supports them as they step into the leadership roles that they already have, but supporting them to show up in spaces where they are not typically welcome. These two organizations worked hand in hand with us as we started sharing our holistic safety framework. And you may be asking, okay, like what is this framework? I've been talking about the framework. The framework is really a model to help correctional administrators to increase safety in their facilities by collaborating with the people incarcerated in their systems and the staff working in their systems with an intentional focus on the emotional well-being of both of those groups. Typically, safety in jails and prisons is about control. As a former correctional administrator, I will admit that there were many decisions that I made in response to violence and in response to harm that was done, where we tried to tighten controls. And what we learned time and time again was that there was no amount of control you can put on a person to make them like comply with everything you wanted them to comply with. Once we would put more controls on, they would find a way to do something else. And it became like this game of like whack-a-mole. We were running from fire to fire to fire, just trying to control people. And it was happenstance that I was asked by the sheriff during my tenure to create not a program, but more of a unit that had a different culture within it. And I had no resources. And I had three officers that were working with me, and I had 10 gentlemen who were incarcerated in the facility who were going to start the program. And it was for people with minor offenses and with serious mental health issues, though. And me being in an administrative position, I was putting out fires day to day. How was I going to start this new um, program with a culture change attached to it? And I had to rely on the staff to help me to develop that. And I had to rely on the men who were starting the program with us to tell us what they needed so that we could deliver. It was through that experience that I first recognized that this was a different way to interact. Historically and traditionally in corrections, we tell people what to do and we expect you to do it. And if you don't do it, whether you're a person incarcerated or a staff member, you will get disciplined. That's how we tend to operate. And through this framework, the key to it is calling administrators to have a different approach. We're calling on them to see the people that they work with and the people incarcerated in their systems in a different way, and to sit at the table with them, literally and figuratively, and ask them what they need in order to be well. That's different for a lot of people, and that's a tough thing to get past. You want me as a correctional administrator to sit at this table with this person incarcerated and have them tell me what I should be doing? Yet the administrators who work with us are taking this different approach, and they are seeing remarkable change. They are not just asking people what they need to be well. When you look at the lock, they are making changes in their system to connect people, not just with other people, but also with themselves. By giving people what they say they need in order to be well, we reintroduce people to themselves. We reintroduce them to what a positive relationship can look like. And we have staff sitting across the table and sitting hand in hand with people incarcerated, making decisions in correctional institutions across the country. And like I said, it's almost unheard of, but they're seeing remarkable change. These five tenets that you see in the lock, those tenets came from the conversations that we had with staff and people incarcerated across the country, asking them what they needed. Many people felt that they deserved the opportunity to make decisions for themselves, so that they could be better equipped to make decisions when they ended their shift to go back home to their families and be the heads of their households, and when they finished their sentence or their time incarcerated and were called upon to make decisions in community. They wanted people to see that they had real value and to ask people what they were interested in and to follow through to help them to engage in activities that actually interested them. and they wanted to be trusted, and they wanted to earn that trust. It wasn't something that they were asking, for people to go into blindly, but they said, if you see me doing well, give me credit for doing well. And again, that came from both staff and people incarcerated. And together, this lock and this key creates the framework. And what it boils down to for us is really helping to reduce the isolation that we saw that people were experiencing in these systems. It's about reducing the physical isolation for people incarcerated with COVID and with staffing shortages. It wasn't just restrictive housing where we were seeing people locked in cells for most of the day. It was across the board. And we were taking this opportunity to provide thought partnership to administrators to help them think through how they could be creative with limited resources and help people to get out of cell more. We were focused on reducing the emotional isolation of people incarcerated. How do we add resources in a way that supports people, their own ability to thrive? Not telling them what we think they need, but listening to them as they share with us what they need and supporting them by providing those resources and those supports. We were focused on reducing the emotional isolation of staff, particularly with the staffing challenges that every prison system and jail system in this country is dealing with. Staff are more and more isolated. And when you come in as a staff person, you are almost trained to leave everything you experience at the facility. Don't take it home to your family. Don't take it home to your friends. So we were asking people to come into work, sh- put on a role, put on a facade, because you can't show your personal side, your human side, and then go home and put on another facade and not show your family and your friends what you've been dealing with. That's not human. That's the inhumanity that we see, that we deal with staff and what we are pushing upon on staff. So really helping them by providing wellness resources for staff. And then this is the biggest one. This was the one that I spoke about earlier. That was the that has been, and I'm expecting will continue to be the biggest challenge, is reducing the interpersonal isolation between staff and people incarcerated. There's a culture in corrections, and it's an us versus them. And staff are trained to do it. People incarcerated are trained to do it. You don't talk to them over there. And that when you have us versus them, it is the foundation for dehumanization. If I don't see you as having similarities to me in any way, then I am more likely to harm you in some way. And that goes for both sides. And so we have been working with administrators to bring these groups together to reduce the us versus them and to support each other in the expansion and growth of wellness opportunities for both groups. We are, like I said, working with systems across the country. We are working from Hawaii to Vermont and have seen great strides being made in each of the departments that we've been working with. And as I said, we back people with solutions. People oftentimes will look at Chicago Beyond's experience because we have a team of people with experience in corrections, mental health, project management, human resources. We have knowledge coming into this, but we don't want the systems to rely on our knowledge. We want the systems to rely on the knowledge of the people within them because that's where the real solutions exist. And systems see that through our thought partnership with them. The thought partnership we provide is really helping administrators to shift that thinking of us versus them. I'm not going to sit down with my staff and people incarcerated and have them tell me what I should be doing. I'm going to tell them. We provide that thought partnership to help them see the people in their care different. We build relationships with these teams. In Vermont, we did start our work with Commissioner Demo. That work is continuing with Commissioner Murad, as well as the entire executive team. And we provide support through regular meetings and just touch points where they update us on the strategies that they, along with their staff and the people incarcerated in their system, identified to address those four areas of isolation that I shared. And we bring a change management approach, a systems level change management approach to help people to shift from what we are doing each day to how. This is not a program, it's really a different way of operating. And right now, with the system like Vermont, we are hoping that they continue to sustain that progress. And I'll talk a little bit about that in just a moment. Now to Vermont and the great things that they have been doing since our relationship started with them in March of 24. So we've been working with them now for 2 years. They started revisions to one of their policies on disciplinary. One of the, things that they recognized was there was an opportunity for them to safely reduce the number of people in restrictive housing by looking at some of their rules that were considered major infractions and reducing them to minor infractions. They looked at some rules that they previously handled from a security level and frankly decided that it was more of a clinical issue. One of those rules is on like medication. People get their medication packs, and if they had a certain amount still on them, it was handled with discipline. They turned that over to the clinical team to handle that clinically and provide education. Now, if someone has, an exorbitant amount of medication on them, of course, that is going to be handled with both teams, but they looked at those with more limited supplies as a minor infraction handled with the clinical team. They removed the COVID barriers in the visitation rooms in all of their facilities. This was something that came from focus groups that they had. So, one of the ways that the executive teams engage their staff and people incarcerated initially is through the facilitation of focus groups. And they sat with a small number of people incarcerated, a small number of families who had been visiting, and a small number of staff. And so many of these ideas that you will see here came from those focus group meetings. The removal of the COVID barriers was one of those. And they did it pretty quickly after those focus groups. Again, the knowledge and the expertise is already in the room. It's just how do we hear it? They supported legislation that Representative Hedrick, thank you, supported greatly, the child-friendly visitation, and they started to make revisions to the visitation policy. I'm not sure that it's been completed yet, but those revisions will hopefully mimic the child-friendly visitation legislation that you all spearheaded. They created a division of engagement, health, and wellness. So they already had a division for health. They expanded it to include engagement, that engagement with staff and people incarcerated, which is a core aspect of the holistic safety framework. And they expanded it to include wellness, to take more of a holistic approach and not just focus on medical care, but to think about nutrition and sleep hygiene, all things to help people to feel as their best selves. And they appointed an executive position to lead that division. And she has been remarkable engaging with the people incarcerated and the staff. And Vermont participated in a virtual meeting that we facilitated over the course of 6 months last year, where we brought together all of the systems that we've been working with and many of our partners in the space who have been incarcerated previously and who have worked in the system. And there was one remarkable woman, Robin Simpson Bay. She is out of Georgia. She presented on ways that departments can better support people incarcerated. And the Vermont team was particularly struck by her, and they followed up with her afterwards. And she looked at their commissary list and helped them to see where there was not price parity for religious texts. The Quran was more expensive than the Bible. She also helped them to see where there were gaps in women's hygiene products and a number of other culturally sensitive products. And they have been making changes to their commissary list as a result. Again, like seeing and engaging differently and hearing differently. For their staff, they have been doing a number of things. They created a video and podcast series to highlight wellness and professional development. They also expanded their family support group to incorporate it into staff orientation and graduation. And I was recently in Vermont, I believe it was early February, and had the pleasure of seeing a staff wellness team person in the facility, and people were taking questions to him, questions about, can we role play this particular scenario? I don't think it went well. They were asking about retirement benefits, like things that I think a staff person would normally just hold and be blind to. They had someone that they can ask these questions of that gave them a source of support that they probably didn't have prior to the department taking on staff wellness in this robust way that they have. And then to reduce interpersonal isolation, I believe you all participated in the reentry simulation that the department had with 50 plus stakeholders. And it was very eye-opening even for them. In speaking with the leadership team, they talked about how there were things in the reentry process that they hadn't understood before that reentry simulation. And they are subsequently trying to make changes to better support people during that reentry process. And they've started including people who have been incarcerated, not necessarily in Vermont, but in systems from across the country in their academy training through their partnership, I believe it's with Turning Point. And they have had members of that team come into academy training and talk about particularly the substance use services that they are providing. All of these things have been happening as fires have been taking place, as issues have occurred, as staffing has been a challenge. Not literal fires, but figurative fires. And they've done it in a way that they've been able to manage what's happening in the facility and still look towards where they can make substantive changes based off of what they have been hearing from their teams. And so we expect that they will continue to make these strides. We hope and expect that they will finalize their disciplinary policy as well as their visitation policy, if those have not already been done. And we expect that they're going to continue their staff wellness programming, as well as continuing to engage with people formerly incarcerated in the academy training. They have done great work, and we have been very proud of our collaboration with them. And it is our hope that Commissioner Murad shared with us that he intended to see this work through. It's our hope that you all will support him in doing that. And one of the ways that I will ask that you all support Commissioner Murad and the team in seeing this work sustained is to help them to own it. And through owning it, I mean asking them how things are going for these policies that are up here. Have they been finalized? What are their learnings? Asking them how their meetings with the incarcerated population and their staff are going. Right now, we ask those questions, and the ownership happens, I believe, when the team there in Vermont, inclusive of you all, ask these questions of each other, even without us being present. And so that is where we hope to see the system go in the future. I'm going to stop sharing so now I can see you all. I've been talking quite a bit and hopefully can answer any and all questions that you have. And Haley, I'm so happy to see you on. So if there's any question, specific to the department that I can't answer, I'll turn to you.
Well, Doctor, thank you so much. This is very informative and I think also very heartening and enlightening. You've been working with our department since 2024, and it started with former Commissioner Demo. How has the transition been to the new leadership in the department? And how do you see it going forward and for how long?
I'm going to answer the question in two ways. One, though we started the partnership with Commissioner Demo, we were very fortunate in building a relationship with the whole executive team. So even though Commissioner Demo left last September, our partnership with the executive team continued without missing a beat. We did make an introduction with Commissioner Murad in February when we visited in person. And he walked around with us. We went to the Northeast facility. He walked around with us and verbalized his commitment to continuing the work. We want to see that show up in the policies being finalized. And hopefully the department will follow through on that commitment by finalizing those policies.
So how long do you anticipate continuing working with us? Is there a date certain, or is it just sort of a handshake agreement?
It is a handshake agreement. They are doing this by their own willingness. I should also say, like, the department is not paying us. We are not paying the department. They are doing this because they wanted to do it, which is commendable. We will continue to engage with them and ask how things are going, but our formal partnership will end this year. And that is why we really want to see the policies in place, because that is one way that we believe this work will be sustained. Turnover happens in systems, but when turnover happens, new leaders don't typically come in and change all policies. And so if we have policies in place, we believe that this work will continue beyond the tenure of any one person. The legislation that you all pass is another way that we believe this work will be sustained, and the continuation of the partnership with Kids Apart, the work that's being done to change visitation spaces in the facilities. Those structural changes tend to stay in place over time. And so the support from this committee will be incredibly valuable to us and the work that the team in Vermont has already done by continuing to ask them about the finalization of the policies and how things are going.
So when does the formal agreement end this year?
Well, there is no formal agreement. We're just collaborating. Again, we provide thought partnership, but we will be ending our commitment, our more, I guess, like rigorous engagement with the department in September of this year.
Yeah. Questions, just to open up dialogue? Kevin and then Brian?
Doctor, I have to confess, before you gave your presentation, I was skeptical. You flipped me 180 degrees, and I wish Troy was here to hear that.
So maybe listening.
He either is watching or will, yeah.
So admitting my closed mind has been opened, I really appreciate it. What data, if any, are you gathering from Vermont that will help us see the value in what I now like and want to support in a bigger way.
Well, thank you for your admission. You know, that's you showing up and being vulnerable. You're embodying the holistic safety framework. Um, so we have, with the things that they have changed, there's a number of data points that I think could be illustrative of the work that they all have done. What is the number of people in their restrictive housing? Have they experienced a reduction based off of the changes that they've made, based off of the staff wellness initiatives? How are staff saying that they feel? Do staff feel more supported, particularly with having a wellness support person there in the facility? So getting some qualitative data from the staff. How are families feeling about the visitation changes that are taking place in the facilities? For quantitative data, are you seeing more families visit with their loved ones? We know through research that family support is important for the success of people while they're in the facility and when they get out. And so wanting to see an increase in those numbers. And then lastly, how are staff and people incarcerated feeling about each other? And that can be as simple as asking if they feel supported by asking a person incarcerated if they feel supported by a staff person and vice versa. One system, not Vermont, but one system that we recently visited with, this is a small change, but the phrase that I've been using a lot this week is big doors swing on little hinges. So in most jails and prisons, it's unheard of for people to even greet each other if you are deemed the other. You know, we started this by saying good morning to each other, very common, right? It sounds strange that people wouldn't greet each other, but staff are trained to not say good morning to a person incarcerated, informally and formally. People incarcerated are trained formally and informally. Do not say good morning to a staff person. Well, the staff and the people incarcerated, after having met for one time, a gentleman who's incarcerated saw a staff person as he was walking to get his food. He was going to what he called chow. And he looked at the sergeant and he said, "Good afternoon." And the sergeant said, "Good afternoon," back to him. And when he came back to the next meeting, he said, "You don't know how that made me feel. I was surrounded by all these other guys, and they were about to laugh at me because I said good afternoon to you, thinking that you weren't going to say it back. And when you said it back, it not only made me feel good, but it showed them how our relationship can be different." So those small things can be represented in qualitative data with conversations with staff and people incarcerated. And I want to thank you all. I understand, I think it was from this week, you all engaged with two gentlemen who had been previously incarcerated in the system. That's robust data that you all are gathering. And as you continue to meet with people who have been incarcerated in this system, I hope you also meet with staff who have worked or are working in the system and just asking them, how are things going?
And that makes perfect sense. Again, but if we're not going the extra mile to actually collect that and see the trends and see that it's actually working, it's just feel good.
Yeah.
And I agree with you 100%, because as we were able to tour the prisons, to be able to engage, we had great conversation with numbers of people. Now, how credible the information was that was being exchanged, we can question that. But just human to human interaction, I agree with you, is necessary for any kind of rehabilitation. And I'm glad to hear you pressing that truth. We need to measure it, though, in my opinion, to say, let's keep the ball rolling, or what more can we do to facilitate it?
I'm glad you are making that push. I'll tell you one system, because we don't go in and tell the system what to do. We ask them, how are you going to measure success? And I'll tell you what's happening in one system that can hopefully happen in Vermont. one system has been looking at their incident data. And we just visited with one of the facilities in the system, and the captain there shared with us that they've seen a significant reduction in uses of force in a 3-month period. And so data like that will hopefully be accumulated by the department and can be shared with you all. Uh, Ownership in Vermont could look like you all asking for that data in an effort to support what they've started in the department.
Thank you.
Right.
Thanks. Dr. Tapia, I guess I'm essentially getting at some of the same questions, but I think I want to get there in a slightly different way, which is to say, you're putting in place structures, we're putting in place rules and procedures, there's this effort to continue this work over time. How do you do that without, the same people being at the table? That makes sense. What I'm familiar with in my time here is that the people have mattered. And so there's this Prison Research Innovation Network, PRIN, that basically relies on 2 academics, right? Abby Crocker and Kathy Fox. Dr. Crocker and Dr. Fox are doing a great job, but I think that's partly because they have trust within Southern State and people know Abby and Kathy, right? I think Lund and Kids Apart have done a fantastic job, but in part that's because of Lund and it's because of Jess who works there. And so I guess I'm curious about the number of points of contact. You guys are ending your official relationship this year with Vermont DOC, but when you talk about the Vermont team, who's on that team, and have you talked to COs? Have you talked to incarcerated people? It sounds like yes. And are there points of contact also between different entities? Like, is Vermont DOC talking to, I was looking at your slide, to Hawaii DOC? Where are these points of contact that are going to make it stronger?
Great questions. So, first, yes, a lot of the work that happens in jail and prison reform is reliant upon specific individuals. What we have found is there is the engagement with the staff in the system and the people incarcerated in the system gives us a different foundation. Like they are the ones leading this. And we have not spoken with as many staff and people incarcerated as the department has. And the department has now seen the benefit of that ongoing engagement. And hence their expansion of their division of health to include that engagement. So they are continuing that work with their staff and with their people incarcerated. We have introduced them to the other departments that we work with through our national justice convening. They met with every department that we've worked with. And through our 6 monthly virtual calls, they met with each of those departments. They have taken core aspects of what they have seen and heard that have sparked their interest, and they are looking at ways to implement them. They heard from teams about peer mentorship programs amongst people incarcerated. Vermont has a wonderful peer mentorship program, the Open Ears program. Many of the other departments we work with heard from gentlemen currently incarcerated in the system, sitting with staff, talking about the Open Ears program. So making sure things like that continue, I think, help to reduce our over-reliance on a particular person, and instead it's spread across the population of staff and people incarcerated. For more specific people that we've been working with in the department, we've worked quite a bit with Kristen Calver, Jim Rice, Aviva, Haley, a number of other people that I'm blanking on right now, but we meet with a wide array of staff. When we were there in February and toured one of the prisons, I had the pleasure of meeting SOS P Corps. Matt Pecor, he stood out to me. I probably saw, not probably, I did show it on my face. He was very stern and stoic throughout our visit and kind of just a little rough around the edges initially. And towards the latter part of our visit, he shared that he was a veteran and that he was leading a lot of the staff wellness supports for the team. And he was really pushing for more supports in the facility. And then I understood his positioning because he's carrying the weight of all of the staff members working in that facility. And he was strongly advocating for them to the commissioner and not backing down. Like that's how this work continues. That's the sustainability of it. The PCORs of the Vermonts, not the Commissioner Murads. It's really with the staff and the people incarcerated in your system.
Thanks.
Yeah, thanks so much, Doctor. This is great. I'm a union guy, so I really appreciate the way you're framing this with, rather sort of imposing a culture on the frontline staff, having a partnership with the labor folks there, and having them have a seat at the table. I think that's important. But question, like, it's always interesting to me when somebody comes with an outside perspective of Vermont, right? And they land here. And I'm just wondering, kind of like, big picture, where do you see, is there anything you see like Vermont Corrections is really lagging compared to other states that you visited in certain areas? Like, like I'm a little worried about the sustainability of this, or if we don't make investments in this area, it could result in some bad outcomes. Because like the money's finite, but I think that's something we struggle with. Where do we put the limited resources we have? Anything, just big picture would be helpful there, Doctor. Thanks so much.
Sure. Thanks for that question. I'll first say that I think that one of the primary investment strategies is policy. Like I'm seeing some of the departments, many of the departments that we've been working with have finalized policies to support the work that they've done. Not only sustains the work, but it helps inform the staff that we are asking to do this work. It also informs the population and their families to know what's happening. Without that kind of clear communication, I'm afraid many people in Vermont Department of Corrections may not know about the implementation of the holistic safety framework because I'm not sure that that communication has been shared with them through policy. I'm also not sure that the work, not that I'm not sure, I will say that monetarily, there will be things that will be asked of you all, like changing the infrastructure of visitation rooms. But there are many things that the department is doing that does not require funding. And so, just the engagement with families who are visiting with their loved ones to say, what's going well? Where do we need to make changes? That can continue without monetary demand. The changes that are happening to better support staff, they may come to you all and ask for positions to fully support staff wellness, but everyone can own a part of staff wellness if it's incorporated in academy training. And so that's why I'm really pushing the sustainability piece. It is really the goal of Chicago Beyond for us to not be the experts in the room. Vermont has the expertise, but how are we going to solidify it in written documentation so that it surpasses all of our time engaging with the department? That's where I'm seeing the lag. That's where I'm really hoping that the department will be able to show us. They really started strong. Vermont started strong when we first engaged with them. And the work that I shared with you all that they have done, much of that was accomplished within the first 6 to 9 months of us working with them. And now it has really been about how do we continue to inspire, particularly the leadership team, to continue to see the value in that in the midst of the challenges that they are enduring. And so that's where I'm hoping for your support, that inspiration to the leadership team to really continue this work and to see the value and the importance of it.
Thanks, Jennifer.
So I have a couple questions. In terms of the safety framework and really working with what happens on a day-to-day, I don't want to say day-to-day schedule, but day-to-day operations and living, I mean, folks are living in these facilities 24/7. Could be the residents there, staff, they're there for more than half the day. I've got two questions. We have earned time here in Vermont for folks. How does that play into, if it does, if you've seen, how does that play into the work that you've done so far? And how does that play into the temperatures, so to speak, within a facility, be it from the staff or be it from the folks who are incarcerated? Do you have any thoughts on that?
I don't have any knowledge of how the earn time is being impacted. Haley, I'm not sure if you do, but I will speak to the temperature of the facility. And this may also go with the last question. I've seen where a facility, not in Vermont, but I've seen where a facility in another system has experienced a reduction in that temperature because they have ongoing meetings between the staff in the system and the people incarcerated in the system. Vermont has not taken that up as a way to minimize the us versus them, but that is one way that we have seen other systems to effectively reduce the temperature. But what Vermont has done that I do believe has affected the day-to-day temperature is they have created more opportunities for people incarcerated to have recreation and to have time out of, their day-to-day celled activities and really help them to feel more human by the engagement. I think they've also reduced the temperature by giving staff the supports that I mentioned before. These are all, I think, release valves for some of the buildup that we see occur. I have not seen it as robustly implemented in Vermont as we've seen in other systems, but there is still opportunity there.
So that helps in terms of what we could do for the temperature piece. But have you had any experience that earn time helps in terms of the management of the facility where folks who are incarcerated are feeling good about themselves if they receive X amount of time off their sentence each month? How does that play for the staff? I mean, there's some incentive there.
Yes.
For the person who's incarcerated to really work with each other who are incarcerated as well as with staff. Because if they don't, they could lose those days.
Because of the impact of being incarcerated, any earned time is wonderful in helping people to get back to their families and their communities sooner and to really step into the things that hopefully they already have within them and the things that they've learned within the system. Behaviorally, it's even better to have incentives within the institution that people don't have to wait as long as they do for earned time. So yes, earned time helps. And having an incentive program within the institutions also helps. That system that I spoke about, that they have seen a significant reduction in incidents, specifically uses of force, they've implemented an incentive program within the facility where if a person incarcerated goes incident free, and there's certain levels of incidents that they don't have the higher level incidents for a 30-day period or a 60-day period. They get to order a meal from an outside restaurant or an outside entity. And that is what drove the drop in incidents. So the behaviorally, the closer that we can have the incentive to happen with the behavior, the more likely you are to see that behavior change and hence that temperature reduction that you spoke about.
So my second question, again, is the safety within the facility.
Mhm.
Have you, in any of your work, looked in terms of the us versus them culture and safety of the facility for folks who are transgender in a correctional system and in correctional facilities? Are you able to weigh in on any of that? Because that really raises some safety issues, both for the person themselves, for that particular living unit, and how the staff reacts to that.
Unfortunately, we have not engaged with that. That would require, I think, us to be deeper in the systems than what we are prepared to be. Again, we really rely on the systems to tell us where they believe the issues lie as they speak with their staff and people incarcerated. And better support for people who are transgendered has not come up.
Questions? Kevin and then Connor?
Haley, may I put you on the spot?
Sure
Tell
thing.
me if you
No.
just really are not comfortable in answering, but how confident are we that the earned time is equally administrated? That there aren't favorites or those that are being punished because they just don't get along with the correctional officers or whatever? Are we pretty confident that it's utilized properly?
That is an interesting question. And for the record, Haley Summer, Director of Communications for DOC. The way that earned time works is that in terms of an individual not earning it is if they've received a disciplinary report, and the process for disciplinary reports and how those are applied is outlined in our policy. So if there were instances in which someone was, for example, disciplining someone to remove their earned time because they didn't like the individual, that wouldn't be consistent with DOC policy, and that would be something that would have to be addressed. In line with the work that we're doing with Chicago Beyond, and that we're updating policy 410, which outlines disciplinary procedures. I'm hopeful that we'll see that process strengthen even more when that policy is updated and reviewed.
I would be more concerned about looking the other way. That certain people just aren't caught, there's no follow through for whatever reason. The favoritism, I guess, is, and I'm going too far, but that's where my question's coming from. If it's equally managed, I can see it as a great management tool. If it's mismanaged, that can make the us versus they worse. So.
Yeah, and I understand that. I mean, I think there's always a risk for that when there are 1,000 staff in a system. There's a lot to account for, a lot of things that could happen, but similarly, it is outlined in policy if someone sees something being done wrong, that they need to report it. Otherwise, that could put their job in jeopardy. So
Good, thank you.
I think a lot of folks don't want to see that happen.
Good.
I want to also say with earned time, we were very, very clear it is subjective. Because when we previously had it, it was very subjective, and we took that away. We wanted to be real clear when someone could lose their earned time. It wasn't used as manipulation as control over that person. That's why you have to have a disciplinary report. So it's not up to the correctional officer. In the past, it was up to the correctional officer. We got away from that. So that it is implemented throughout the system equally. And we do have rules. You had to put in administrative rules statutes, directives, and policies, but you had to do administrative rules, so it's much more structured. Kevin, maybe not Kevin, Connor, whatever your name is.
It's
Friday.
So, Doctor, I don't want to put you in the middle of sort of the debate we're having on the future of a forensic facility in
I was
Vermont.
gonna ask, I was gonna ask.
But I think it would be criminal not to
One.
tap your expertise, in working with systems around the country and being a psychologist. I'm wondering if you could just, maybe in general terms, are there guiding principles we should consider as we look at a setting to restore competency to individuals who, are maybe a risk to the public? And I guess I would ask, as far as management structure of such a setting, an actual physical place for the restoration of competency. Is that fair?
So I'm sorry to disappoint you, but my expertise is not in forensics. It's in corrections, which is very different.
Okay.
But
Helpful.
in
Yeah.
speaking with Representative Hedrick, I did share with him someone that I previously worked with in the past who is an expert in forensics. His name is Mark Hireman. He currently works with the Monahan Law Group here in Chicago, but he is an attorney by profession with more than 40 years of experience with law advocating for the support of people with mental illness. And he is someone that I would suggest that you all engage with. And then, true to our holistic safety framework, if you all have not already done so, I would recommend talking with people who have been housed in such facilities in correctional systems and outside of them, as well as staff who have worked in them, to better understand, what some of the issue areas are and what some of the gaps have been, particularly for people who have had to be restored to competency within a carceral setting.
Would you be able to tell us what the model is in Illinois?
I'm sorry, I do not know what the model
Okay,
is
no worries.
in Illinois. Since I've been deeply enrooted in embedded in corrections in Illinois, I'm sure things have changed. I don't want to misspeak and say what I think
Oh,
that it
fair
is.
enough, fair enough. Yeah.
But Mark Hireman will know. I'm telling you, he is my person and has been for many years that he's been in this field.
Great, thanks so much.
That's very helpful to have that resource, and we may follow up in our committee assistant party to them and everything, and maybe if you could help, if you have contact information.
I do.
Send
I
that
do.
to our assistant T, that would be terrific. The other thing I'm thinking, Doctor, is that we're gonna be finishing up our legislative session here pretty soon, hopefully. And during the off session, we have a committee that is set up. It's called Joint Justice Oversight Committee. It meets about 6 times over from the beginning of the summer to the end of the calendar year, to just keep tabs on what's happening in the criminal justice system where DOC is part of. And I would, I'm thinking of reaching out to you at some point to maybe do the same presentation to that particular committee.
That would be
I think it would be really helpful for them. And also, they might be looking at the forensic situation as well, and Mark would be a good person to also bring in at that point too.
I would be more than happy to share this presentation and offer any insight I can during that meeting time. I will also share that Chicago Beyond will be co-presenting with the New York State Department of Corrections and Community Supervision during the Legislative Summit that's happening in Chicago this summer. If any of you will be attending, we'll be presenting on how the New York State Department of Corrections has been implementing the framework quite successfully.
That's great. Well, you'll be hearing from us probably either June or July. I want to do this. I'm chair of that committee as well. I would like to do this prior to the September timeframe because that's when your formal structure with DOC comes to an end, so I want to do it before then. For that, so you'll be hearing from us.
Thank
Yeah.
you. Looking
It will
forward.
it will be a different person than Tate. Her
Okay.
name will be Megan Canelli. Canella, it's so Italian. So you'll be hearing from her.
Great.
Any other questions here? This
Very helpful.
is
Thank you
very,
so
very
much.
helpful. Thank you so much for taking the time today.
Thank you.
And,
Thank you.
and we'll be in touch, I'm sure.
Thank you. I hope you see Chicago Beyond as a resource. We're happy to engage in any way.
Thank you.
Thank
Thank you,
you. Have a
Haley.
great day.
Yes, you
Bye-bye.
too.
Thank you, Haley.
Yeah, thank you, Nika.
So for the committee, we are done for the day. So we're having a field trip,
Yes, Tuesday afternoon,
1 o'clock, or two,
supposed to be there 9:30
You said
see what,
at the dam.
by 1:30, 6, how long to get there? 15 minutes?
If even, yeah,
Where's it located?
it's just, yeah, you just keep going down Elm Street for like, 8 minutes, I would
Oh,
say,
all right,
yeah.
just go down now.
Can't miss it. It's-
Okay. That will be it for Tuesday, right? So we got on
Yeah.
Tuesday. And then Wednesday, we're having a joint House, Human Services and us to go over the new draft of H 193.
Well, that's just a discussion with Village Council. That's not witnesses or.
We gotta look at the
And
language.
where will that be?
It's in room 11.
Okay.
They're a great crew. I felt very accepted this week, I don't know, Brian.
So I have,
McGuire for the rest of you.
so I had a conversation with, Martin, after we get off the floor, they're still working on another draft. The thinking is that we were hoping to get the bill transferred to us during the floor on Tuesday, but he's got a little bit more work to do on it. So that physically won't happen until probably Wednesday afternoon. But we will have a new draft that incorporates what they have worked on to date and what we had worked on with Katie to date. And I spoke to Teresa Representative Wood. They're working on some language too, and if they can get that done by Tuesday afternoon, that will be included in the draft. So that we can see the whole package and then go from there. Because, you know, we gotta connect different, we gotta do a lot of connection between the front end of the process when someone's in court and our world and the policy world upstairs in services. We gotta make sure all that language tracks. So Eric Fitzpatrick and Katie McQueen will be presenting that walkthrough of that proposal.
Are we close anywhere with human services?
I think we're close to the
Felt
people.
like it.
I mean, everybody thinks it's kind of fragmented at this point. It will come together. It will come together. And then we'll see where the holes are. We've got to put the whole bill together first, complete strike all of what the Senate did. And we've got to see how that, all that language intertwines or doesn't. We've got to see where the holes are and where it's all connected that works. The goal is still for us to, we'll get that bill middle of next week. And then if we can get it out next Friday, great, that's the goal. So we could have some long days next week. We don't know, I don't know what's gonna be on the floor.
So Tuesday, we dress casually for the,
I'm gonna dress like I normally do and I'll just put on sneakers. Right,
And when you say get it out, that means from us back over to the Senate?
get it out so it goes to the floor.
To the floor.
It's gotta go to the floor
And then
first.
back over to the Senate.
Yeah, we're working that end, because we're trying to avoid.
You're already,
conflicts.
you see
Oh, yeah.
those skids.
Oh, yeah, there's work. Yeah, there's already work. We're getting out of here, folks, in a couple weeks, 2.5 weeks. So you gotta work backwards.
Yeah.
So it's getting these bills through. The capital bill, I asked the chair of institutions last evening. It's coming on the floor next week on Tuesday. I said, could you do second, third reading and suspend rules and ship it over to us? So we can have it here
Yeah.
Wednesday, so we can figure out I don't know if that's gonna happen or not. If that doesn't happen, we won't get it until Friday. So I'm trying to push them a little bit so they can suspend rules and start the processing. Because if we don't suspend rules, we're not out of here by the 15th. We gotta start suspending rules. Get stuff moving. So that's where we are with the capital bill. That's where we are with S-193. The parole board bill, 559, is on the floor in the Senate today, I believe. Senator Major is the reporter. I signed him this morning. That will be coming over to us next week. As soon as we get that, I'll be asking him to come in. And hopefully maybe Wednesday afternoon. Hopefully. So he can walk us through what changes, because there were some amendments there that were made. It was based on the Victim Notification Task Force recommends for the parole board. I also want to give Mary Ann Ainsworth a heads up about that as well, because I want to hear from the parole board if those changes work. And then we'll have to make a decision. Do we concur the Senate proposal of amendment?
Mhm.
Do we not concur with further proposal of amendment, or do we put in conference? So that's coming over.
Mhm.
They had the telecommunication thing and the gender equity. I spoke with Wendy, James, you were there.
Yep.
Trying to help them push those two bills out. The concern for one member on 294 was the minimum wage piece. I was like, it's only a study. There are two studies, that's all it is. And then gender equity, they're still trying to figure that out. I did recommend to Wendy, we had Dr. Uger and Dr. Morrison. I recommended that they schedule those two folks. I'll be working on some language there, which I've got to connect with Hillary on that language to see, she can just do a draft. Post draft. So that's where we are. Am I missing anything?
Yeah, we don't have anything to do with it, but education, you got any idea what's going on there? Be out of here at 15?
Depends on how different the Senate Senate education goes to our bill. Depends how far
So, yeah.
apart.
We should take possession of that too.
Right.
Education bill.
Discussed this subject before.
Supervisory fees that did come out. I think Rob Plunkett is the reporter that Senator Plunkett. It's got to go to finance and it's got to go to Probes. That is out. So we're looking good. We got some work ahead of us. I don't think I missed anything. Good. And then the rest of it is out of our bill. Those are other people working on it. We'll go along for the ride. Anything else before we finish up for the week and go home?